Welcome to Headliners 4. We're here to bring you the best in Texas journalism, the stories behind the great stories. I'm your host, Mark Morrison. Our special guests are Laura Rice and Leah Scarpelli of Texas Standard. They and their team won the Showcase Gold Award for Enterprise and Innovation in this year's contest for the best storytelling in Texas journalism. Their Texas Standard special report, called The Long Haul, marked 1 year of the coronavirus pandemic. Laura and Leah, congratulations on your great journalism and this award.
Thank you so much. It's so cool to be here representing our team.
By mid-March of 2021, Texas had reported more than 2.5 million coronavirus cases and almost 45,000 deaths. Texans were facing extended waits to obtain unemployment help and long lines at food banks. Texans were also experiencing pandemic fatigue, worn down by unprecedented restrictions on their everyday lives and exhaustive news coverage. Laura, the team numbered, I think, 17 of you at Texas Standard, wanted to add something new to this massive and massively covered subject. How did you set out to do just that?
Well, the reason that team sounds so large is because in our credits, we really went back and credited everyone who was involved at every level. And what we drew from was what we had produced over the past year. And getting to that point was actually quite a challenge. It was really our first challenge. As you said, we knew that every news outlet everywhere was going to be talking about 1 year of the pandemic. And so we really struggled for a while. We went back and forth many times about what were we going to be able to say that was going to add to this story? You know, how could we cover this without adding to the pandemic fatigue and the trauma that people had felt with all of this? It was very fresh at the time. And so we went back and forth, and then we realized we'd had some success in the past with the oral history format. And it's something that I think a lot of us really enjoy, really going out and collecting interviews. And then we thought to ourselves, wait a minute, we have that. We have an oral history in our year of reporting. And so we treated everything that we had done that had anything to do with the pandemic over the previous year as our source. Which ended up being a really interesting approach and gave us something to draw from that gave us a uniquely Texas story because it centered the Texas experiences that people had shared with us.
Right. Leah, one of the creative ideas came from digital producer reporter Caroline Covington, who suggested telling the story through the lens of Maslow's hierarchy of needs. Please tell us what that is and how that helped focus your report.
Well, Maslow's hierarchy of needs is a fairly well-known psychological theory that sort of gives a framework about how humans operate and what their motivations are depending on the different levels of needs that they fulfill them in. And I don't want to get too in the weeds with it, but Caroline had reported a lot on mental health in the past, so it made sense to her. And especially since our typical format for a show has 5 segments in it, and there are 5 basic needs in Maslow's theory. So it just kind of made sense. I think whenever she first brought it up, it was just like, you know, a light bulb went on, essentially, for all of us. So those needs are first physiological, so it's physical well-being, so shelter, food. Those needs are sort of like the more physical in nature, like what you need to survive. And then it's followed by safety, love and belonging, or community, then esteem or personal value, and finally self-actualization or a sense of meaning to one's life. And what happened was, as Laura said, the staff really got together and went back through like the specific segments that they had produced and pulled sound clips, you know, and there was like the way that we organized them, it was all in place in one place. So we could all just kind of like throw those sound clips in there And then when we were sort of done doing that, it also included some stories from the Texas Newsroom, which is the statewide collaborative that we're a part of. And then David Brown, the host, wrote around all of this tape, and using the Maslow's theory as a guide. And it was really quite like both a logical, I think, and beautiful way to structure the show. And for me, as sort of like I'm the director of the show, I scored the entire show with music and pulled things together, edited for time. And so it was a good way for me to sort of like pick music, thematically for these 5 segments. So it just really worked out.
It was very effective, and the other device you used was to tell the story of the pandemic in a chronological way with a lot of viewer input. Laura, what were some of the early reactions of Texans to the pandemic when it first hit, and some of the impact started to take effect?
Well, as Leah mentioned, it really was kind of natural to unfold the story this way, because the first impact was just survival for people. It was access to food for many. It was being able to continue to have shelter, to have employment, to fill basic needs. I mean, it can be a little hard to remember sitting here in September of 2022 just how terrifying and different that was when it first began. My first recollection of how big an impact this was going to be was when the city of Austin canceled South by Southwest. And then people stopped going to work in person in many cases when possible. As you said, businesses couldn't operate. They were not just because they made the decision, they were prohibited from operating. People couldn't gather. I mean, you mentioned access to food, and I think you can think back and recall in your archives of your memory those very long lines of people waiting at food banks across the state. We were all running out of toilet paper, which, it seems like a joke now, but that was, I mean, if you think about basic needs, being able to care for yourself is a very basic need. I mean, it was like a hurricane had hit, but it wasn't affecting an isolated area. It was affecting everybody everywhere at the same time. And it was scary because there was just so much that we didn't know or understand yet.
Right. Some of the most poignant comments were about getting medical care, and also from the wonderful healthcare professionals who had to figure out how to prioritize and deal with patients, and also deal with the shocks that they were experiencing with so many deaths. Leah, could you talk about that a little bit?
Yeah, I mean, I think like in so many places in the country, before it really hit Texas, we saw it in New York City, right? Just like this massive overflow of people needing care, and there literally just not being enough room. And also the ventilators. This disease was so mysterious at first and unprecedented. How were people supposed to know that they needed this many ventilators in stock? So hospitals were full, and I think also efforts to figure out how to contain the virus, like contact tracing, were really confusing at first. And like the different departments responsible weren't really on the same page. And of course, the virus could be very deadly. So everyone working in hospitals, doctors, nurses, I feel like it's important to mention the maintenance and the administrative staffs. Like my mom was an administrative assistant in a hospital at the time. They were like in direct threat with the virus on a daily basis, but they still showed up, often working long hours, putting their livelihoods at risk. And that includes their mental livelihoods, like you said, like just seeing so much devastation around them. And then also the PPE being in short supply, that was another thing. Um, and yeah, just the other sort of, besides, the medical workers, I just wanted to mention too, like the other jobs of the economy that were considered essential. So people couldn't, like education and construction, in a lot of cases, people just, they still had to go.
Right. Laura, talk about the impact on education and the young generation of Texans who couldn't go to class for long periods of time.
Yeah, I mean, looking back now, so much of the conversation has been about the mental health impacts of that separation and of virtual learning. But with this new deadly virus spreading so quickly, sending kids into the classroom felt like it was not an option at all. I mean, teachers were concerned about their own health. Parents of immunocompromised kids or with vulnerable people at home have continued to feel very at risk. There was the challenge of virtual learning itself. So many of us had never heard of Zoom, let alone used it. And then we were teaching it to our kindergarteners. And so then it was, parents feeling burdened, having to, in some cases, juggle the needs of their careers and also, try to be as a second teacher for their kids because their teacher was somewhere online who may not have been accessible, assuming you even had the technology and the infrastructure to connect in the first place. And then there were the teachers themselves who just were feeling completely overwhelmed in a brand new situation, literally thrown into the deep end and not really given the tools and the resources because nobody was prepared for this in this way. And we've continued to see what that did to our teachers. I mean, we're seeing teacher shortages this past year, and that is absolutely still a trickle down from people just feeling so exhausted from the burden of going through the pandemic, whether that was virtual learning or dealing with the stress of the risks to their own health. All of those different things have continued to impact, and we're seeing the impacts on mental health now on kids. We're seeing the impacts in test scores and as just as an entire I don't know, group of people. We're all trying to figure out how to lift students back up, make teachers feel supported, and it's continued to be difficult.
Right. Leo, Texas maybe wasn't affected quite as much as some other states, but nevertheless, um, in regard to the election process, but nevertheless, the pandemic did have a profound effect on the election here. Can you recall how some of your interviews reflected that?
Well, I think a lot of people felt that they were putting themselves in harm's way by going out to the polls, being around people, not being able to maintain a distance of 6 feet. And so in Texas, you are allowed to vote by mail if you are disabled. So I think a lot of people were sort of considering themselves at risk, uh, and they were sort of like making that association, like, okay, like I'm putting myself at risk if I go out, therefore I should be allowed to vote by mail. And I think that courts in Texas first allowed the expansion of mail-in balloting, but then that was challenged by higher courts. There was a lot of back and forth. There was a lot of confusion. And I think that, there were arguments about more absentee balloting contributing to election fraud. But I just read today, they were sort of thinking that more mail-in balloting was going to actually allow more people to vote, but it didn't actually do that in a significant way. So I think overall there were just a lot of court challenges and a lot of back and forth, and people wanted to vote and they just weren't sure about it.
Right. Laura, Texans of all colors and ethnicities and ages suffered, but the impact was not spread evenly. What did you hear from the populations that were hit the hardest?
Well, I think the quote that still sticks with me is from Dr. Peter Hotez, who was one of the leading voices and has continued to be throughout the pandemic. He's a vaccine expert with Baylor College of Medicine, and he called this time a historic decimation of Hispanic communities. And we saw that especially in San Antonio and in the Rio Grande Valley, but throughout Texas. And the reasons why I think that people are continuing to study, continuing to learn, but it's a disproportionate amount of people in the types of jobs that Leah mentioned that required in-person activity, that didn't allow a work from home option. It's people who were part of multi-generational families, which are wonderful and supportive in many ways, but in this cases may have exposed older adults to COVID-19. There was also a rise in anti-Asian hate, and we saw that with misunderstanding and hurtful labeling of the coronavirus as the China virus, of course. And then amidst all of this, there was then a reckoning over racism in the United States, and there were huge numbers of people all across the country, including here in Texas, who went out and protested after the police killing of George Floyd, who was a Texan. And so just a really a moment where a lot of things were coming into light. And again, I think we're still just beginning to sort of understand in some ways the impact and what was revealed in those months, especially early in the pandemic.
Right. Well, there were a lot of negatives for the listener to absorb, but as your special was aired, Texans were beginning to see some light at the end of the tunnel as vaccines were widely available and businesses starting to reopen. Did you find some positive reactions in the Texans who were, in many cases, beaten down by the pandemic?
Yes, and
Leah, why don't you take that one?
yeah, I love how this sort of also fits in with the structure of our show based on Maslow's theory. I think that Texans were, and many people were still able to find connection under such extreme and isolating circumstances. I think maybe some people met more of their neighbors because they couldn't go far, but they still needed to get outside, or they discovered a love of gardening, or a way to appreciate nature in more profound ways, or just other creative ways of enjoying what they had liked to do before. Of course, Zoom meetings with family and friends. I think there was a student in our special who she was lamenting, that her senior year was definitely not traditional, definitely not what she expected, but it was in some ways the creation of new traditions, something totally unique, and also I think just enjoying simple pleasures. David wrote that at the end of or at some point in this, he wrote that Texans found a way to look. Can I pick that up, actually? I'll just say, David wrote in the special that Texans found a way to look beyond what was right in front of them. And I think that's definitely true. And I think also, when you think about the sort of, mythological in many ways, the rigorous Texas spirit, we hear in the last segment of our show how certain people weren't going to let COVID destroy their spirit.
Yeah.
And in the midst of so much confusion and loss, they were going to somehow find meaning in it, and they did.
And really, there was a lot of resilience expressed by interviews with the people starting all the way back at the beginning throughout. You could hear that in their approach to how they were coping with some really serious problems. As the 9-member panel of judges noted, the Texas Standard Special is a poignant look at the cost of COVID-19 and a rich example of multimedia storytelling. The memories of families were stark reminders of the lives lost. Lee and Laura, your work truly put into perspective what was a long haul for all Texans Congratulations to you and your team on winning this well-deserved Headliners Award.
Thank you so much. It was a
Thank
pleasure.
you to
being
the
with you today.
headliners. Yeah, for honoring storytelling. It's really meaningful.
On our site, headlinersfoundation.org, you can link to this winning special report and to interviews with other award-winning Texas journalists. For my colleague and Headliners Forum producer, Gary Pickle, I'm Mark Morrison.